right, welcome to This Week in Health IT. It's Newsday, our last episode of the year. Today, we're going to talk about vaccine distribution, which is really dominating the news cycle. We're actually going to do a little predictions for 2021, Drex and I. Why not? Since none of the predictions for 2020 were correct, we'll try it again for 2021. Maybe we'll be a little more accurate this year. My name is Bill Russell, former healthcare CIO coach, consultant, and creator of This Week in Health IT. I want to thank Sirius Healthcare for supporting the mission of our show to develop the next generation of health leaders. Their weekly support of the show has allowed us to do an amazing amount of stuff this year to expand our service offerings and to develop new content for the community. And for that, we're incredibly thankful. If you haven't signed up yet for 3X Drex DeFord, our co-host for today's show, has a service, 3X Drex, 3 stories 3 times a week, vetted by Drex. Just text Drex to 484848. Drex is in the house. Good morning, Drex. How's it going?
Hey, how's it going? How's everything down in Florida?
Florida is nice. You know how hard it is to say 3X Drex, text Drex to all that. I mean, it just sort of, from a tongue twister thing, it's I've said it so many times now, it just comes out. But how's that service going? I mean, I looked at it this morning. You had a story about vaccines and a couple other things, a bunch of security stuff. So yeah, how's the service going?
Yeah, it's going good. I mean, I think it's something that I started really about a year ago now, and did it just without any sponsorship. Really kind of just wanted to try to get some stuff out there. I had originally, been told by some folks that I was posting a lot of stuff on LinkedIn and that they were really honing in on that, skipping a bunch of other things. And so I said, let me try to do something by text because nobody else does that. And, it's going well. I get good feedback every issue that I send out. Somebody winds up, or more than one winds up either sending me an email or sending me a text back and telling me that something in there was really surprising or good or interesting or whatever. So it's fun. And it's really, I don't know that it's going to turn into anything big. It's mostly just a way for me to communicate to folks who like to hang out.
Yeah. I was going to launch 3X Bill, but it just didn't go. So we're just going to keep referring people to your service. Actually, it's a phenomenal service. I pick up 1 or 2 stories for this week for this show every time.
Yeah.
So you're signed on for 2021. We are this format has actually, a lot of people like this format. So I found a couple of your peers. So Sue Shade's going to join me every 6 weeks. You're going to join me every 6 weeks. I have 2 others that I can't announce yet because they're getting permission, but they're pretty sure that they're going to do it. So we're gonna get the news from a lot of different perspectives. We're gonna have 6 different co-hosts next year. I didn't want to overwhelm any one of you with preparation, but we're gonna do this format for this show all next year. So it's gonna be a lot. And actually, I enjoy this more. I enjoy the back and forth. It's a lot easier.
I think it works really well too. And you found some folks that you work really well with and can have really good conversations with. Sue Shade is ridiculous. I mean, she's amazing. I mean, first of all, just her background and the skill and talent that she has and all the interim stuff that she's done since she's kind of pretended to hang it up. Yeah, she has so much experience and insight. She's going to be a great co-host. You're going to have a great time with her.
Yeah, we've had several conversations over the years. It's interesting because there's some things that we don't necessarily, and this is what I like, and I'm going to really try to push this more next year is the areas where we don't see eye to eye. People I think listen to this show and think we agree on everything, and we don't necessarily agree on everything in terms of approach and those kind of things. I mean, there's some things obviously we believe in project governance and intake and different ways of doing that and how important it is. And we believe in the digital foundation for health. I mean, there's a whole host of things that we're like, yeah, we fundamentally agree on these things, but there's ways of going about things that I think we spark each other's thinking and ideas towards. So
I agree.
Towards that, let's talk vaccine. One of your stories from this morning was vaccine. I highlighted a couple on LinkedIn. The vaccine rollout is I guess we are at the starting gate. I think a lot of health systems are saying by the end of this week, they're either going to get well, I think the Pfizer vaccine is going to start going out this week, and then the Moderna vaccine will be following in the not too distant future. So we've actually had a little bit of a conversation about this before. How just I don't know how to tee this up, because it's interesting to me, because we've known this was coming. This is not a surprise. We've known this was coming for a long time. You would think we're flat out ready. We're prepared. Hey, we've done flu vaccines for years, and we'll just take that module and away we go. And your story that you highlight today is about using paper to track the vaccine usage. I mean, is that really going to be the best method, with given the amount of money we've invested in technology at this point?
That's the point that I made in 3X Drex this week, was the idea that we spent 35, or depending on what numbers you see, $38 billion in the meaningful use period to build electronic health records and all this stuff. And now we have a vaccine. It might be the most important vaccine that you will ever take in your entire life. And we're going to keep track of it on a little paper card that they're going to give you when you get your vaccine. Here, sir, please take this, fold it up, put it in your wallet. And then when you come back to get your next vaccine, we're going to need for you to produce this again so we can make sure that everything matches up. And I mean, there's a whole bunch of things in this. I mean, first of all, does anybody carry a wallet anymore? That's just start right there. You know, that could be a problem. But just I think this is why we still have fax machines in healthcare, right? We've built big, complicated digital electronic health records. We've discovered, surprisingly, that they don't interoperate very well. And we're working on all that. Don't get me wrong. People were bending over backwards. They're working really hard to try to fix this stuff. But man, it's painful to think that we're going to go into this with paper records. And I sort of jokingly called it the other day when you and I and a bunch of other IT people were on the phone.
You did.
And I said, I bet you we wind up going to some kind of a paper record for this. Like, I spent 20 years in the military. We had a paper shot record. If you've been in the military, you know what I'm talking about. It's this little yellow form, and you carry it around.
We used to have the little gold. We used to have that with vaccines as well when we were kids. We had this little vaccine record, and I mean, I guess no one thought about, hey, you could easily forge that, but we had that record. We'd take it to our school and say, look, there are little checks next to these vaccines. We've got them, and they would accept it. It's crazy.
Yeah. So I worry about this, but you know, the other part of me is keep it simple, stupid. And if paper will work and we can figure out how to make it work, then maybe that's a good route. I know when I get mine, I will immediately take a picture of it and store it on my phone. And that's probably how I make sure that I, keep track of it. But
I'm probably going to get a tattoo just to let people know. Well, I mean, how else are they going to know? People are going to be walking around going, hey, that guy doesn't have a mask on, tackle him. And I'm going to be like, no, look at my tattoo.
I have my card. It's going to be interesting as we go through this. And I just was on a call with some friends from London this morning, and they were saying that they have started giving out vaccines there. And the conversation very quickly evolved into exactly where you're going, which is some people are going to get vaccines early. They're going to be people who are in long-term care facilities and healthcare workers. And so healthcare workers are probably going to be able to start doing things that the rest of us are going to have to continue to be hunkered down for the next 6 months or 8 months until everybody gets their vaccine.
Right.
So how's that going to work? Are they going to have some kind of a special ID, that they produce, another paper document that they have to carry around their shot record proving that they got their ID so they can get into a football game or
Here's what I want to do. I want to structure this conversation a little bit. So you and I both have experience as CIOs, and I sort of want to break down the challenges that are associated with this. I mean, we were on the same call, and when we asked some doctors, when do you think we would get it. So I'm in my 50s, fairly healthy and those kind of things. And they said, yeah, at the earliest March, at the earliest, because that's just the pecking order of who will be getting this. And more than likely, it'll be later in the spring that we would get it. So let's break this down into some of the challenges that we face. First of all, it's a two-dose vaccine, two-dose regimen. So you have the initial shot and the booster, and that's where we're talking about the card, right? So if you get the first one, you get the card, you carry the card with you, which we all hate. I mean, none of us like to go to stores that require receipts for returns anymore. Amazon's changed all that. And so we're going to have that card, which will mean, in theory, which will mean I can go to one health system for the starter shot and another for the booster shot, and have my little card, and it will indicate. Now, the problem with that, I mean, let's start with that two-dose regimen and say, all right, we need a way to notify people that they are eligible for the vaccine, right? So it's going to start with first responders, frontline workers. It's going to go to those who are at risk, maybe the nursing homes and other places and those kind of things. And it's going to move through those channels. As we move through those channels, we have to keep track of the people who've gotten it the first time and who need to come back the second time, and follow up with them to make sure they come back the second time. But we also have to have a mechanism for scheduling this. So my parents are already saying, hey, how do I get on the list? How do I get scheduled? And that's going to be health system by health system kind of basis, right? And you're going to need some queuing mechanism, either a digital queuing mechanism or some other mechanism. I mean, maybe it's an email mechanism, maybe it's a fax, maybe it's a text. And actually, I don't really care which one it is, but you need a queuing mechanism to let people know that they can get the vaccine. Otherwise, people are going to start showing up at the emergency room, I think. So what mechanism are we going to use to let people know? Because to be honest with you, there's part of me that feels like we're going to have to convince people to take the vaccine, but I'm really more in the camp of, I think people are kind of tired of the way we're living right now, and they're ready to be beyond it. I think there's going to be a line, at least up front. I think there's going to be a line of people going, yeah, let's get to the other side of this. Sign me up. And they're going to be asking the question, how do I get in line? How do I get in line?
Yeah, that's a great question. Hopefully there's some analytics people that are working overtime right now that are sort of figuring out what is the shot protocol, what is the vaccine protocol for, first we're going to do this group, then we're going to do this group. And I mean, they've tried to lay it out a little bit already, saying healthcare workers, frontline responders, and long-term care facility individuals get the shot first, and then who gets it after that? Well, there are a lot of protocols that have been laid out, and like you, I think it was the New York Times that had a pretty interesting little tool that they published maybe last week that let you put in your age and whether or not you had comorbidities, and ask you if you were a healthcare worker, and then it told you your place in line locally compared. If there were only 100 people in line, where are you? And I was like 96. I was way in the back of the line. But there's comorbidities, right? That's another thing that you're going to look at. These are people who have other healthcare problems that we want to make sure get the shot, because these are the kinds of comorbidities that are most likely to have a very negative outcome if they get COVID and they have this pre-existing condition. So that has to be part of it. Like I said, I hope somewhere in your health system, there are some analytics folks who are working through this, searching through your electronic health record, finding people, building some kind of an order. And then the conversation comes down to, how do you contact them and where do you contact them? Are these people who live local? Do we have the right phone number? For folks who have Salesforce and are probably doing some at-risk contracting and are in regular contact with their customers, because they're always trying to make sure that they're doing all the things they should do from a preventative health perspective and staying healthy, they're probably going to have a lot better luck than a lot of others who I think are going to struggle with the who's on first and who gets it first.
So here are some of the questions I think we need to answer. And actually, we can even make this easier and just say who gets it first within the health system, right? So a lot of health systems are doing surveys right now of their staff to ask the question of who wants to get the vaccine. You got to determine if the insurance is going to cover it, if the health system is going to cover it in terms of the cost. You have to have a tracking mechanism, right? So I guess all EHRs have a tracking mechanism for tracking vaccines in that we've done the flu for years. I don't know how much more different the build will be for COVID, or if we're just going to use the flu, whatever the flu workflow is, and just mark it as COVID somehow or whatnot. I would imagine that's going to be a pretty easy workaround. The other challenge, to be honest with you, I know in the state of Florida, or at least I'm being told in the state of Florida, only 5 health systems are getting the first supply of vaccine, and in the month of December, right? So first of all, not all health systems are getting it. Second of all, they're not even getting enough to cover their workers. And so there's a communication process here. And we keep talking about how do you get in line? That's a question that needs to be answered like today. If you're listening to this show, this needed to be answered actually last week. It needed to be answered last week. Your community, there should be news stories on all the major news. You should be posting on social media. This is how you get in line in Southern Florida. This is how you get in line in Seattle to get the vaccine. And oh, by the way, here's the CDC guidelines. That there's nothing magical about that New York Times
it's a super simple tool.
Yeah, I mean, you and I with probably with somebody with a little more programming skills than us these days, but could probably have that written up by this afternoon and put on our website that says, "Hey, do you want to know roughly when you're going to get the vaccine? And oh, by the way, when you're done taking that, click on this button if you'd like to schedule an appointment for this range of times, and we'll contact you via text or those kind of things." So we have that aspect. But then we also have the public health aspect, Drex. I'm looking at this going, how are we going to track the immunity, right? We need to get to 8. I've been told numbers that are really high, and I don't know if this is the case or not. But given how this thing really passes from individual to individual, it appears to me they're saying, look, either people who have had COVID or people who have the vaccine has to get upwards of 80 some odd % to really slow the spread of this.
That is the herd immunity number, right? That is the point at which if 80% are immune or have had the vaccine, then yeah, you're at the point where the virus has so few places to attach that it really starts to become insignificant.
So am I going to have to report that information to the CDC?
As far as the number of vaccines that you've provided?
Yeah.
I'm sure that there's going to be a reporting requirement. There has to be.
Has to be. So what if I've done 75% more of the first shot than the second shot?
Yeah, I definitely worry about that, right? Because people will come in and get the first shot and feel like they're probably going to be okay. Or they're going to come in, they're going to get the first shot. They're going to feel like crap because that may very well be a side effect. And then they're going to decide that they're not going to go back and get the second shot. What's that effect going to be? How many of those people are going to fall into this bucket?
All right.
And
so
what does that do for immunity, right? Because we know for other things like taking antibiotics, you got to take all the antibiotics or you might just supercharge the bug. I don't know if it works the same way for a vaccine. We'd have to get a public health person on, but.
All right. So then let's move beyond. So people start getting it. And actually the time frame to me, I'm not worried about the summer because as we're seeing in like Australia and other places in the summer, this thing did not really take off. It's for whatever reason, more outside, more ventilation, whatever the reason is. I'm not a doctor. Don't hammer me on these things. but we're seeing this in the Southern Hemisphere right now. It's summer. It's not spreading as much, but we're in winter. People are indoors. We have surge going on all over the place. But in the spring, I'm worried about a certain amount of people are going to have gotten the vaccine. A certain amount of people will have had COVID. And my guess is it's going to start looking like normal come March or April, and it really probably shouldn't yet look like normal. So how do we go back to normal safely? And is it a passport? Is there a technology solution? I joked about the tattoo, but how am I going to know that Drex has had the vaccine and this person hasn't had the vaccine, and we get to next major holiday would be Easter or Memorial Day, that kind of stuff. When we start to get together again, how are we going to know we're safe?
Well, I mean, I think it's the same kind of thing we do now. And I think this is going to go on for a while. You're going to have your bubble. Probably a lot of people are going to continue to wear masks no matter what, even if they've had the vaccine. I think we're going to find out that people are going to say, you should continue to wear the mask. Yeah. Just because it's hard to say somebody not wearing a mask, did they have the vaccine, right? You get into this whole issue that you were talking about earlier. The whole passport thing worries me a little bit, because then that gets into the ability to do fraudulent stuff. I know that there were several companies that looked early on into this idea that you could go to NBA games if you took the survey about not feeling well, or if you had the vaccine or whatever, and then you could get into the game, really show up 15 minutes before the game, and you can get in. And otherwise you have to go through this sort of the line where they give you you have to pass through all the protocol tests. But man, I think it's still pretty messy. I think we're all very hopeful about the vaccine. We know that it's coming soon. You have some vague idea where you are in line, but there's all the messiness that's around this right now. And that includes, I mean, all the logistics stuff, right? The cold chain for some of these vaccines are really hardcore, and you don't want to get, I mean, if you get a shot from a spoiled batch of vaccine because it warmed up, you wouldn't know that. And what's that effect going to be? So there are a lot of things. I mean, even buying refrigerators. I'm talking to friends at health systems, and their health systems are buying refrigerators now. And then I'm talking to friends at smaller health systems in rural communities who are like, we can't afford those refrigerators. So how are we going to get the vaccine? This whole thing is really sort of continued to amp up the haves and the have-nots in healthcare, bigger health systems and rural health systems and smaller communities. And I think we're going to continue to see this exacerbated a little bit as we get into the vaccine march. Yeah.
Well, I think we've done our duty here. We had a couple people that we were on the phone with earlier last week where they said they were going to do a drinking game and drink every time we said the word vaccine in the show. At this point, they are underneath the table. We've said the word vaccine a fair amount. It's these are some interesting questions, and IT clearly is not answering these questions by themselves. But there's an awful lot of data challenges. There's scheduling. There's follow-up messaging. There's reporting. There's an awful lot of challenges associated with this that will fall squarely on the health IT leaders, and it will be interesting. I've not heard of a system yet that I've talked to who has said, yeah, we've got this wired. We feel pretty good about it. It's new. There's a lot of unknowns.
Yeah, it'll be interesting to see as we get into January how this evolves, and whether or not we have a national plan that is then duplicated by the states. I mean, the challenge is vaccine is coming. Like, you get it, somebody's getting it next week. So if we have a plan, we need to know what the plan is. I'm totally with you, Bill. And I don't have my head wrapped around it yet. I'm not seeing it.
Yeah, I'm not seeing it. And I actually talked to somebody in Florida yesterday. I said, what are the 5 health systems that are getting it? And they're like, they can only name 4 of them. And when they were done, I'm like, okay, you didn't name any in Jacksonville and you didn't name any in Southwest Florida. They're like, yeah, I mean, it's going to Miami, it's going to Orlando, it's going to the major metropolitan areas because that's where we've seen a significant outbreak. And I understand that. Look, the supply chain, it's not like they can pump out 50 million doses in December. They've got to ramp up the supply chain. They've got to make sure that the supply chain lasts as long as it needs to last, which is a fairly long time at this point, in order to because we're not only talking about vaccines in the U.S., we're talking about vaccines
around the world.
Around the world, yeah.
I mean, even the simple things like the glass vial problem, and on and on and on. It is a super complicated logistical challenge to resolve, and hopefully we have some good people on it.
Yes, and I think we do. And so, you're a space geek. We're going to talk about SpaceX, high altitude Starship. We'll talk. Providence has actually announced their remote work back from COVID. So we're gonna hit those in a minute. But I do need to discuss the CliffsNotes referral program because my team will be mad at me if I don't. The CliffsNotes referral program. If you're not familiar with CliffsNotes, you get an email 24 hours after each episode airs. It'll have 4 video clips. It'll have a summary, and it'll have bullet points of the key things that were said. This is a great way to stay up to date, great way to hear from great leaders. We just had Darren Dworkin on this week, actually this Friday, or last Friday, we had Marty Paslick.
He was really good. Darren, because I loved his background with all the old Mac computers and everything sitting back there.
Yeah.
Commodore 64s. And...
Yeah, I've been in there a couple times. He fired up the Trash 80, the TRS 80. It's a Radio Shack machine. Back in the day, he did fire it up. He said, and you could smell that sort of burning silicon smell. And he goes, I thought it might be smart to power it down before I burned down a building in Beverly Hills. So you can imagine. It amazed me that those things run, but he swears that almost all of them will power on if you.
He has quite the collection in his office, in that outer area, and then in his office too. Old computers.
Yeah,
I think that's a hobby of his.
It's pretty amazing. Well, yeah, you've been down there to help with the accelerator as well, haven't you?
Yeah. He's they have quite a. I mean, Darren, just on his own, super smart guy, does everything from investments to being the CIO at Cedars-Sinai. Pretty incredible career. But the accelerator, just on its own, was one of his and the team's brainstorm down there to be able to bring companies in that have opportunities to change healthcare. And they've actually been really successful. Many of the companies that have gone through this accelerator, have gone on to be really successful. So.
Well, the thing I like, and I'll get back to CliffsNotes referral.
Sorry, I got you sidetracked.
But the thing I love about talking with Darren on the show is I send the guests like, hey, here's the topics, here's some questions I'm thinking about asking, and for the most part, I stay on those. And when I get on with Darren, he essentially looks at me and says, yeah, you can ask these questions. Ask me anything you want. Let's talk about whatever you want to talk about. So he's one of the few people that I can just go, hey, I have this question, and he's been great to answer them and share the things they're doing. CliffsNotes referral program. If you're not participating, the easiest way to do that, just go to our website. You can hit subscribe, and you can subscribe to CliffsNotes. If you want to recommend it to somebody, right now we have this referral program going on. If you get one referral, which Drex, you do have a referral, by the way. If you get one referral, you're entered in the program. So you can receive a work from home kit, and we're going to do that drawing on January 1st. If you get 10, you get the black moleskin notebook, which is sitting over there on that table where I was journaling this morning. And if you are the number one vote getter. I'm not going to force anyone, but you get the opportunity to come on this show and discuss the health IT news with us. And if you're wondering if it's too late, it's not too late. This goes all the way through the month of December. And the leader on this only has about 4 or 5 referrals. So nobody's gone out and gotten 20. We've got a whole bunch of people that got 5, 4, 3. So it's actually a pretty close race. I think people sent it to a bunch of their friends. They signed up. And I think the best way for this is if a CIO were to send it to their staff.
The whole staff.
The whole staff and say, hey, you should sign up for Clip Notes. They would flat out be the winner. And
for sure.
And I think it would be interesting. Actually, if I were a CIO, I would do that. And here's why I would do it. If nothing else, you set the foundation for your team staying current and having good conversations. That's why I would do it.
Do that. Send them an email and tell them to sign up for Clip Notes and 3 extracts. And if you do that, you got the old double whammy going, and your team's going to know what they're talking about. They're going to be in the know. Yeah.
So I'm going to save the SpaceX ones for the end. That'll keep you tuned in to the show, because I know you're a huge SpaceX fan. Well, just a space
fan. Yeah.
All right, Providence. How Providence will bring back remote employees. So Providence is in your neck of the woods, 51 hospitals and an awful lot of people working from home. Let's see, with the vaccines closer to reality, Providence has finalized post-COVID-19 virtual work strategy for administrative employees to modernize how work will be performed in the post-public health crisis. What we will be doing in the future is giving employees the ability to have more flexibility, collaborative, engaging work experiences. Mr. Till said a lot of that is accelerating plans that we've been working on for the last several years, and we've projected what the future will look like. Mr. Till, by the way, has to be in this article earlier. Greg Till, Chief People Officer. There you go.
HR. Mm-hmm.
There you go. July 1st will be the earliest that remote administrative employees can return to facilities and offices unless they can't work productively from home, Mr. Till said. A few employees will work on-site daily and a few will work from home daily, but most of Providence's administrative workforce will work anywhere from 2 to 4 days a week from home. Where an employee works day to day will be based on the individual and their role, he said. Based on what we've seen so far during the pandemic, we believe that it's going to be something that improves our employee experience and their productivity. Our indicator that gives us confidence in this approach is our recent employee engagement survey, showing that 7-point improvement from those who have been able to work remotely. Providence will replace personal offices and cubicles with flexible, open, and shared hotel work and collaboration spaces to support the hybrid model. So, the reason I pulled this story up is because I've talked to a lot of CIOs about it. And this is the first one that's just coming out and saying, hey, this is what we're going to do post-COVID. Have you seen any others at this point?
No, I think there are a lot of folks who are thinking about it and considering what the process is going to be to bring people back, or even if in some cases they're going to bring people back, because I think there are a lot of folks too who are thinking long-term, this work from home thing may be a thing that at least some subset of employees are going to be very well suited for. But this is the first one that I've seen sort of publicly announced. This is our process, and up and until July 1st, and probably going to change the date, but up until July 1st, if you want to work in the office, you're going to have to get permission, kind of, is how it sounds.
Oh yeah, absolutely.
Yeah. So it's the first one I've seen, and it's good. I'm glad, again, people are kind of thinking over the curvature of the earth. This is going to ultimately get resolved, and you're going to have to figure out what you're going to do post-vaccine administration, post-pandemic. How are you going to run the show?
What do you, curvature of the earth? What are you talking about? It's not flat? Anyway, the thing that strikes me about this is that not everybody can work from home. And there's aspects of this I'm not sure we've thought through completely, and we will eventually as situations come up. But let's assume an employee starts to struggle working from home. They, miss a couple meetings, for whatever reason. Is the follow-up, is the performance plan to bring them into the office so we can watch them more closely? I'm wondering, I mean, you've worked out of your home. I've worked out of my home. I've said this on the show before. It's not the easiest thing in the world. I think everybody thinks it's, oh, this is great. And I understand why the employee satisfaction went up, because it is great. But at some point, it does take a fair amount of discipline to keep that door closed, to stay at work, to not go play with the kids, go play with the dog, go whatever. It takes some discipline. So I'm wondering are we training people to work from home, and how are we going to address people who struggle to work from home?
Yeah. I think as you have people work from home, the companies that have done this well have done a lot of sort of training for those folks. Here's how to set up your work environment. Here's the things you can do. These are things that you shouldn't do as far as distractions. And then a lot of it is definitely the person. I'm a great morning person. By the time I get to early afternoon, my ADD kicks in. I start to get really super distracted with everything, and I have a hard time getting things done in the afternoon. I have a lot of friends who are, their sort of chronic complaint is, I don't have any rituals about, I used to have to get up in the morning and take a shower and then get in the car and drive to work. And that's when work started. And then I left work and I drove home and I saw my dog and took him for a walk. And that's when the day ended. And it's a much more difficult thing when you work from home. Everything runs into each other. People are finding themselves working 16, 17 hours a day because it's just, they don't have a clear break point in their day. So you definitely need a lot of sort of ongoing training and coaching about what you expect from employees working from home. And then the other problem is not everybody has a place. Not everybody has a workspace like you and I do. A lot of people have roommates, and 2 or 3 of them if you live in an expensive place like Seattle. And so trying to get work done when you have 2 or 3 people trying to work from home, that's a whole challenge in and of itself. And then of course you have kids and all the other issues that go with it. It's not the easiest thing in the world.
Yeah, but even just the stuff you just said had so much wisdom in it, right? It's understanding your work. So I get up at roughly about 5:30 every morning. And the reason I do is because I know I am almost worthless afternoon. So, and actually I knew this when I was the CIO as well. I planned all the really important meetings in the morning, and in the afternoon I did my walkabout.
Right.
Yeah, right. So I either went to a hospital and walked around. I walked around my staff. I mean, because I have energy to have conversations. I just can't sit in front of a computer and create a presentation or anything creative after working 6 or 7 hours already by lunchtime. I don't have that creative energy left to really do anything. There's a lot of wisdom in that. I have 7 things every morning I come in. Number 1, clean off your desk. It's crazy, but I will tank as an individual if my desk is dirty. Like I just can't function. And so the first thing I have to do is clean my desk. I do that every morning. I create a daily planner. What are the things I need to get done today? I read and journal. I do a daily post. I have one problem that I get out of the way before I eat breakfast. And it could be write a difficult email. It could be whatever. But you know what that represents, Drex? And the stuff you just said represents? It represents decades of working from home.
Mm-hmm. And being self-aware and really thinking about not being mad at yourself because you can't focus as well in the afternoon as you can in the morning, but consciously building a program for yourself that says, I'm going to take advantage of what are my natural strengths. So if I'm good in the morning, let's do all the hard stuff in the morning. Let's do all the socialization in the afternoon. It still takes energy, but not nearly the same kind of focus. And for me, I mean, I was the same way. Great in the morning, a little weaker in the afternoon when it came to focus. But what I had in the afternoon was a real ability to sort of be empathetic and listen and sort of process that kind of stuff. I was better at that in the afternoon than I was in the morning, because in the morning I was trying to figure out how to get through a pile of work. Yep. So yeah, and as a leader, I would say the same thing. It's not only knowing yourself, it's knowing your team. So you have to not only figure out these things about yourself, you have to figure out these things about your team, because you want to take advantage of their natural strengths too.
All right, next year you're going to be my person to go to for space stories. So SpaceX first high altitude Starship test could happen on Tuesday. What does this mean? I mean, first of all, what is the Starship? Why should we even care? And what high altitude test? I mean, what they're going to take this thing higher and then do what?
Yeah. So I'm definitely not a SpaceX expert, but I've become a pretty big fan of many of the programs over time. Starship is sort of
that's their intergalactic
deep space. Exactly. That's the deep space. That's the going to Mars spaceship. And there's a lot of work and a lot of testing that's going on with Starship right now. And if you've seen, they've done some short hops with Starship, right? This is just the ability to make sure that they can land components. How is this going to work? And basically it looks like a giant grain silo, and they sort of take off and they move it 50 yards across the ground, and then they set it down again. Well, this is going to be, if they get it done today, they'll do about a 50,000 foot test. So they will launch this thing 50,000 feet in the air, then they will bring it back down and try to land it. And so for every one of these, there's a lot of systems. I mean, these are super complicated machines, and trying to get one back and not break it is a super complicated task. And so it's going to be kind of fun to see, as we saw with the Falcons, sometimes you got to break some eggs before you sort of figure it out. So I fully anticipate that this will not go well, and they'll learn a lot from that, and then they'll do it again and again until they get it perfect.
Yeah, so it's hard not to root for Elon Musk, and he does some goofy things. He says some goofy things, but at the end of the day, it's hard not to root for the guy. I mean, he gave us Tesla, and he's given us SpaceX, and there's such promise in both of those things that it's just fun to root for him.
Yeah, I mean, you look at SpaceX, and I mean, you look at the Starlink program that he has going on right now, where he's just dumping satellites. I mean, almost on a weekly basis now, going up and dumping high-speed internet satellites into the atmosphere, into the space atmosphere. And the idea for that would be that a lot of places that can't get high-speed broadband today would be able to get it and have good, solid, high-speed connectivity. And that has all kinds of implications for us. And we talk a lot about 5G and how 5G is going to change everything. But I really think, now we're getting into predictions maybe, but I really think that Starlink, once Starlink is really up and running, that a lot of rural facilities and rural healthcare organizations that don't have access to that kind of broadband, it's really going to change the world for a lot of people who just don't. We take it for granted because we live in a city, but a lot of rural places, it's dark out there.
Yeah, and we might as well just go into predictions. And by the way, I agree with you on this one specifically. I think 5G's day in the sun is a couple years away still. First of all, the build out's not there. Second of all, to be honest with you, there's still some hurdles in terms of coverage and some other things that they're going to have to get through, like getting through buildings, and so we still have a bunch of hiccups to get through before we get to where we want to get to. And second of all, we already have a fair amount of bandwidth with 4G, and most of the time you're on a network anyway. We've proved that people can work remotely, which means if people can work remotely, we've proved that almost everywhere we can reach with this computer, we can do remote patient monitoring and do all sorts of, we could start to stand up acute care facilities in the home. But I do believe that what you just said is probably going to be the biggest thing in the network, and that is Starlink and some of the other competitors that are out there. And we're going to start to see, maybe another billion people be brought onto the internet, and at pretty high speeds, and the ability to do some things in those rural communities, in those remote communities that are really going to transform healthcare. It's going to be interesting to watch.
Yeah, no, I'm with you. I'm excited about it. Telemedicine, telehealth, like you said, being able to do care in the home, all those things really depend on having access to broadband. And there's so many places in the US that don't right now that but that's gonna change. That's gonna
So
change a lot of stuff.
any other predictions for next year as you look at this?
So there are things that I don't even know about that it makes me wonder. Like, so for example, going back to the vaccines, take another drink. Going back to vaccines, one of the vaccines, so usually when you do vaccines, you inject some weakened version of the virus or some damaged version, dead version of the virus, and your body reacts to that and builds antibodies. One of the vaccines this time actually does something, uses a technique called mRNA, which is, I mean, it could get super complicated, but essentially what it's doing is you're being injected with a piece of DNA code that is going off to your cells and saying you need to build this kind of antibody, and then you're building antibodies. So your chance of getting sick at all from that vaccine is, it's not like they're injecting a dead vaccine in you. So there are things like that I think we don't, just generally purpose, regular people like you and I don't even think about. I think there's going to be more of those kinds of inventions, more of those kinds of discoveries that are going to be done next year that it's hard to even predict. I think back to the old trials back in the day with O.J. Simpson and DNA, and people were like, DNA, what are you talking about? That's not a thing. They're just making this up. It can't be a real thing. And now everybody knows about DNA. And now we have this mRNA thing going on, amazing, ridiculously cool capability that, I don't know, probably just only a tiny fraction of people could really even understand that this is something that could be done. There's going to be a lot more of that kind of stuff in 2021.
Yeah, I agree. The DNA to messenger RNA to proteins, and just if you watched anything on how this vaccine was created, they generated one of the 29 proteins, which is the spike protein.
Right.
And then essentially they have to get it to come into your body so that it gets accepted. But once it gets accepted, then your body's immune system sort of goes to work on. I mean, just listening to all this stuff is like, it just really drives home your point, which is we're doing things now that has really been set up by great work that has come up until now. But I agree with you. I think it's going to accelerate. I think we saw the DeepMind protein folding AI thing, which is unbelievable in terms of how much that's going to accelerate. That solves a 50-year-old problem, and really takes what we just saw with this vaccine and accelerates it even further, as well as some things I don't even understand at this point. And I think we're going to see one of the things coming out of COVID, out of this pandemic, is going to be the acceptance of digital, the acceptance of AI, and really watch it just go to town. And I think it's going to start next year. I think it's going to be AI in the pharma space. I think it's going to be AI automation around communication, around robotic process automation, and those kind of things. I think there's going to be so much AI. People are going to say, I'm tired of hearing about AI, but we're finally it's not going to be just the terminology being thrown on top of a product. I think we're actually going to see some real use cases around AI and some really interesting things happen in 2021. I mean, I think it's that close. It's going to be really fun to watch.
There's the thing about AI that I think, at least in my head, AI is something to me that is always aspirational, and we always are looking forward to some AI solution for something. There are a lot of things like Siri or Alexa that probably fall into that AI category. But once it becomes common use and that's not AI anymore. AI is this thing that we don't have. So I wonder if we'll continue down that path. There will be lots of ML, lots of that kind of stuff that becomes part of our daily lives, that we will continue to aspire to something that doesn't exist yet.
Well, Drex, this has been great. I'm looking forward to 2021. We'll keep doing this every 6 weeks or so. We'll come together. I think it'll be fantastic. Thanks for this year, and hope you have a good holiday. It seems early to say this, but hope you have good holidays.
Thanks. Same to you.
All right, that's all for this week. Don't forget, sign up for Clip Notes. Hit the website. Just hit the subscribe button. The easiest way to do that. Special thanks to our sponsors. Channel sponsors: VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, Sirius Healthcare, Pro Talent Advisors, Health Next, McAfee, Hillrom, for choosing to invest in developing the next generation of health leaders. This show is a production of This Week in Health IT. You can check out the website, check out the YouTube channel. The only other thing I want to make you aware of, and I can't even remember what it is right now. Why, Drex? Because it's 12:53 where I'm at, and I don't function anymore. That's what happened. Oh, I know what it is. We have our end of year shows. So we have a best of This Week in Health IT, this show. We have a best of the Newsday show. We have a best of the COVID series, which I think is interesting to hear how all the different health systems were addressing COVID.
Yeah.
And then we have our top 10 countdown. So the last 2 weeks of this year, we're going to be dropping those shows, and you're going to want to tune into those things. So that's a wrap, as they say. Thanks for listening. That's all for now.